Exploratory research, observational designs. As clinical scientists continue to question how we can achieve optimal outcomes under defined clinical conditions, we must examine the multiple factors that influence our patients' and clients' lives. Studies that help us gather this information are considered observational because data are collected as they naturally exist, rather than through manipulation of variables as in experiments. Observational studies may be considered descriptive or exploratory. Descriptive studies are in the next module. Exploratory research is the systematic investigation of relationships among two or more variables. Researchers use this approach to predict the effect of one variable on another, or to test relationships that are supported by clinical theory. Diagnostic and prognostic factors are identified through exploration of the relationships with the results of specific tests and patient outcomes. Retrospective research involves the examination of data that has been collected in the past. Because the researcher cannot control operational definitions of variables of the reliability or completeness with which data was collected, the accuracy and credibility of the data source become important considerations. In prospective research, variables are measured through direct recording in the present. The researcher follows the subjects as they progress through their treatment or evaluation. In longitudinal study, the researcher follows a cohort of subjects over time, performing repeated measurements at prescribed intervals. The advantage of the longitudinal method is its ability to accumulate data through intensive documentation of growth and change on the same individuals. Longitudinal data are collected in a time sequence that allows for documentation of the direction as well as the magnitude of change over time. In a cross-sectional study, the researcher studies a stratified group of subjects at one point in time and draws conclusions about a population by comparing the characteristics of those strata. Think about the design compared to longitudinal. What are the advantages? What are the disadvantages? The foundation of exploratory study is the process of correlation, a measure of the degree of association among variables. Correlation is a function of covariation in data, that is, the extent to which one variable varies directly or indirectly with another variable. In exploratory studies, researchers do not attempt to control or manipulate the variables under study, only to measure how they vary with respect to each other. Therefore, exploratory studies are not used to test differences between groups or to establish the presence of cause and effect relationships between independent and dependent variables. This is an important distinction when interpreting correlational outcomes. There may appear to be a strong correlation between two variables, x and y, because there is actually some third variable, z, that causes both x and y. The purpose of a correlational study is to describe the nature of existing relationships among variables. Data from this type of study often provide the rationale for clinical decisions or the generation of hypotheses. A predictive correlational study is designed to predict a behavior or response based on the observed relationship between that behavior and other variables. Predictive designs can be used to develop models that can serve as a basis for clinical decision-making to understand factors that impact the success of interventions. This approach is especially useful for validation of diagnostic and prognostic information. A statistical technique called regression is used to establish the accuracy of prediction. Another purpose for correlational study is the testing of theory. With this approach, the researcher chooses specific variables for study based on expected relationships derived from deductive hypothesis. This approach is illustrated in a study by Rausch and others who used regression statistics to test the theory that developmental changes in bone strength are secondary to the increasing loads imposed by larger muscle forces. They hypothesized, therefore, that increases in muscle strength should precede increases in bone strength. They investigated the relationship between lean body mass and bone mineral content in 138 boys and girls who were longitudinally examined pubertal development. They were able to demonstrate a consistent temporal pattern of peak body mass preceding peak bone mineral content. Their analysis was able to establish an association between body mass and bone strength, independent of gender and height. The authors understood the limitation of correlational analysis for deriving cause and effect conclusions and speculated that their findings do not exclude the hypothesis that the two processes are independently determined by genetic mechanisms. A case control study is a method of an epidemiologic investigation in which groups of individuals are selected on the basis of whether or not they have the disorder under study. Cases are those classified as having the disorder, and controls are chosen as a comparison group without the disorder. The investigator then looks back in time, via direct interview, mail questionnaire, or chart review of previously collected data, to determine if the groups differ with respect to their exposure histories or the presence of specific characteristics that may put a person at risk for developing the condition of interest. The advantage of case control design is that samples are relatively easy to gather. Therefore, case control studies are useful for studying disorders that are relatively rare. A disadvantage is the potential for uncertainty in the temporal relationship between exposure and disease. Your textbook outlines several design issues that affect the validity of the design: selection of cases, selection of controls, analysis issues with potential biasing. In a cohort study, also called a follow-up study, the researcher selects a group of subjects who do not yet have the outcome of interest and follow them to see if they develop the disorder. Subjects are interviewed or observed to determine the presence or absence of certain exposures, risks, or characteristics. Cohort studies may be purely descriptive with the intent of describing the natural or a disease. More often, however, they are analytic, identifying the risk associated with these exposures by comparing the incidence of specific outcomes in those who were and were not exposed. One advantage of a cohort study over a case control study is the ability to determine the onset of the condition. A temporal sequence can be established for the relationship between exposure to risk factors and development of a particular outcome. This sequence is necessary for drawing inferences about causative factors. The disadvantage of cohort studies is that they are not useful for studying disorders that are uncommon in the population. The epidemiologist is ultimately concerned with identifying those factors or exposures that cause disease or disability. Because case control and cohort studies do not involve direct experimentation or manipulation of variables, the validity of statistical association between exposure and disease with these observational designs must be made under conditions that are not strictly controlled. Therefore, the researcher must first rule out influences of bias, confounding, and chance variation, and then must assess the strength of cause and effect criteria. There are 5 criteria: time sequence, strength of the association, biologic credibility, consistency, and dose-response relationship, that when taken together be used to provide evidence for a cause and effect relationship. Methodological research involves the development and testing of measuring instruments for use in research or clinical practice. The outcomes movement has provided the impetus for comprehensive methodological study of health status and functional assessment tools. Reliability questions focus on the rater and the tool. Intra-rater and inter-rater reliability should be established to support the accuracy of measurements taken in a clinical study. Validity questions of methodological studies centered around the development of a new tool. This process can be very time-consuming and expensive. Historical research involves the critical review of events, documents, literature, and other sources of data to reconstruct the past in an effort to understand how and why past events occurred. Lecture this week is similar to last. There are articles posted for class. If you prefer a hard copy, please bring it. It is strongly suggested that you read the articles once before class to familiarize yourself with the content. You will review the articles together in class.